Good morning, everybody. Good afternoon. Sorry, it's really a great pleasure to present you today our progress about new insight for the biomedical field using 3D printing and innovative materials. So before scientist contribution. Professor Jean-Marie Raquet and I, as supervisors to 3D4Med project, have prepared a brief presentation of this Interreg project with, you will see that, an efficient cross-border cooperation. So the main objective of 3D4Med is to develop biocompatible shape memory matrices combining structure and activity biological surface using all opportunities of 3D printing and even beyond. So indeed, the general concept of our collaboration is to propose new polymers which can change shape form after a stimulus, such temperature, pH, or mechanical action. And in this project, shape memory polymers are mainly activated at 37 degrees Celsius to adjust the form to the defective tissue to be replaced. And for that, we can rely we can rely on 3D printing to develop objects responding to structural and mechanical properties required for cellular and tissue engineering with low inflammatory response promoting self-healing. So 3D4Med is a collaboration made of academic research group, university hospital, and also a small industrial through transdisciplinary applied research in material science, tissue engineering, and medicine. So more specifically, the University of Mons in Wallonia proposed to coordinate the cross-border partnership in the France-Wallonia-Flanders Interreg program. So this mission is efficiently realized with Eurasante, a French health cluster dedicated to tech transfer in life science sector. Another side, Umons propose also the expertise into additive manufacturing materials with functional properties. And today, Umons work closely with the University of Ghent and KU11, the KULAK, to adapt these functional materials to biomedical application as artificial muscle. So the consortium can also rely to IMT Lille Douai and in France to prepare the scaffold of all new materials using 3D printing. And after, all materials proposed are sent to University of France to investigate biocompatibility and biological activity. And today, we propose to focus on two of our research presented by Nicolas Baleine from Umons, Mélanie Gerard from KULAK, and Marie Dubus from URCA. And after that, we will have the interesting opportunity to listen to experts of biomedical and health application. And I would like to thank again Professor Cathy and Professor Valenti Prat for the participation. Thank you very much. So now, Nicolas Baleine, if you can share your presentation, just after, no, but just before, I would like before giving the floor to our speakers, I would like also to thank, of course, of our financial support. And please feel free to send me an email or to visit our website for more explanation. So now I can give the main to Nicolas, and have a nice talks.
Okay, I don't know if you have access to my presentation.
It's perfect, Nicolas.
Perfect. Okay, thank you, Samira. So, good afternoon, everyone. Thank you, Samira, for the kind introduction. So, I'm Nicolas Baleine from the University of Mons, and today I will talk about the development of electromechanical sensor based on hydrogels iontronic in the framework of the 3D4Med project. So this study has been done with the collaboration of the University of Cergy-Pontoise in France and the University of British Columbia in Vancouver in Canada. So a short introduction about our laboratory in the University of Mons. So the University of Mons has two sites in two cities, Mons and Charleroi, and the laboratory of polymeric and composites materials is located in two locations in Mons. First, Nova, which is an R&D center, and of course, our laboratory at the university. So as that's been introduced for my talk, today I will talk about electromechanical sensors, and let's see some field of application in terms of biomedical applications. So first of all, they can be used for the control of soft robotics, but it can be also used as sensor for the human body motion, or also to control the voice of detective human. So there are several types of electromechanical sensors. One is the resistive type sensor. There you have a materials which is designed as a single layer, so it's a simple materials, where when you apply a deformation like a pull, you have a change in the percolative conductive pathway, and so a change in the resistance that can be measured. So as an example, we have here monowall carbon nanotubes. Try to have my pointers. So you have monowall carbon nanotubes that are mixed with PDMS, and then when you apply a pull on the materials, you have a difference in resistance, but the constraint is that when you apply a pressure on these materials, you have no response at all. A second type of electromechanical sensors can be the capacitive type sensor. There you have a sandwich structure where you have dielectric that are sandwiched between two ionic conductor layers. And there, when you apply the deformation on the material, we have a change in the contact area and the distance between these two conductive layers. And this will change the capacitance of the material. So here in the example, they use the capacitive type sensor for a robotic end, and they try to apply different pressure on different type of objects. So a soft object like a sponge, a middle hard object which is a tomato, and a hard object which is an apple. But we can see several things. First thing to know is that we can distinguish the different softness of the object, as we have different signals for the different hardness of the object. But we can see that for the soft object, we have quite a lot noise in the signals, and for our object, different pressure leads to, let's say, the same signal, so we cannot distinguish the pressure that is applied on the object when you have a too hard object. So this is the problem of capacitive type sensors. So today I would like to introduce you a new type of electromechanical sensor, which are called the iontronic type sensors. And these materials use the piezo-ionic effect. So it's materials where inside you have ions, and these ions have different mobility. And so when you will apply a non-uniform deformation on these materials, due to the difference of mobility of the ions, you will have a separation of these ions, so difference of concentration at different spots on the materials. So this will lead to the generation of an electrical voltage that you can also measure. For the development of this type of ionic sensors, one type of materials is really interesting. It's hydrogels. Why? Because they are really versatile in the field of properties that are needed for this electromechanical sensors. So first of all, they are flexible and elastic. They can be transparent, conductor, which is really important as we have electrical signals. They can be biocompatible and have properties similar to human tissue. And of course, they also can be 3D printing. So they are really interesting type of materials for the design of iontronic materials. So in our study, we use a neutral matrix, which is acrylamide, and we put an macro ion, which is fixed within this matrix and which has a small counter ions. This is really important because by fixing these micro ions in the matrix, you increase the difference of mobility between these micro ions and the counter ions, which is not fixed in the material and can move freely in the materials. So you will increase your signal like that. So we have printed these materials, so we can see a picture here of our systems. But okay, you have your system. You need to know, can you rely on the result of your material? So first of all, we apply constant deformation repeated 1,000 times. So what we need is a fast response, a quick response, and a constant response over time and over several cycles of deformation. So we apply this deformation, and what you can see is that we have a direct response in terms of voltage within this deformation. So, and what we can also see is that the voltage is completely constant over different cycles. So now we have a materials that work perfectly, but okay, this is for a constant deformation. What happens when you change this deformation? And first of all, we look at the amplitude as a function of the strain. But what we can see is that we have a nonlinear response, 3 regimes that can be explained. First, a small strain, we are in a dominant potential regime. So this is the first regime. There you have only difference in potential due to the modification of concentration at different spots in terms of ion concentration inside your material. So this follows this dominant potential. But when you increase your strain, as you are with a swollen materials, what happens is that you have a streaming that happen. You have a streaming behavior. So it's follow. So the amplitudes start to follow the Darcy's law, which is completely dependent of the pressure that you apply on your materials. And then at really high strain, then you have a saturation of the signal, which is completely normal. But what is really interesting is that if we don't look at the strain this time, but if we look at the pressure, the stress, if we look at the amplitude over the stress, we have a linear response. So this is really interesting to compare it our different systems. And this is consistent also with the streaming-like model that I explained just before. And we can see that we have a response, modification of the response of 1 millivolt per megapascal. So you have quite a good sensitivity over a large window of pressure. So okay, we know that our materials works. So now we can see if we can modulate this response, this sensor. So first of all, we can change the ion type, going from cationic microions to anionic microions. We can also change the charge density, putting more charge to see if we have a better response. And we can also try to change the cross-linking density of our materials. See if we have more compact materials, we have less mobility inside the materials. So first of all, we check about the ion type, and the results are as expected. We have a polarity that is completely dependent of the mobile counter ions that we use. If we use a mobile cation, we have a positive signal, and a mobile anion, we have a negative signal. But what is interesting is that the output voltage is higher for the cation than for the ion. And this is due to the mobility of these ions. the cation is more mobile than the ion in our matrix. And that's what explains this difference between the two. Then if we look at the charge density, when we increase the charge density, we have a clear increase of the response. So we have an output voltage that's dependent of the charge density, and we have higher response with more charge. And what is really interesting is that the high charge density materials have a really good sensitivity at low stress, at low pressure. So it's really interesting for applications. And then looking at the cross-linking density, then you also have a dependence of the voltage with this cross-linking density. And as expected, more cross-link materials, so more compact materials, leads to lower response because you lower the mobility of your ions inside the materials. So this is completely expected. So based on this result, we try a practical demonstration. So we use our materials as a fingertip. And what we can see is that we have a direct response of the materials for the touch. And also we have a consistency of the signal while applying a consistent force. And if we look at these two graphs, we can see that we have two signals really different if we use big touch, high pressure on the left and a low touch, a small touch on the right. So you can really discriminate the touch force, which is really interesting that we have seen it. So these are promising results for the use of hydrogel iontronics as touch sensors. So I would like to thank my supervisors, Professor Jean-Marie Raquet and Dr. Jérémy Audin, and of course our collaborators, Dr. Blaise Van Keysel and Guyenne from the University of Cergy-Pontoise, and Professor Madden and Dr. Yuta Dobashi from the University of British Columbia. I would like to thank also Interreg for the funding, and of course, thank you for your kind attention.
Thank you, Nicolas, for a very nice presentation, talk. No, so maybe Mélanie Gerard can share the presentation. I propose to you to do the three first presentation and maybe to talk about all together for a general aspect.
Okay.
Thank you, Mélanie.
Okay, I hope the screen is, you are able to see the screen well?
Yeah, yeah.
Okay.
Everything is well.
Okay, thank you. So welcome from my side. I'm hoping you are interested by what we are telling you and that we can evoke some discussion afterwards. So I'm going to discuss the development of piezo-ionic hydrogels to improve engineered skeletal muscle. So it's in fact another application of materials that Nicolas just discussed. So first of all, what we do in our lab, in the tissue engineering lab, is we make muscle in the lab. So how do we do this? We take stem cells, so stem cells that reside in the muscles, from living donors or from people that have just deceased, so in which the cells are still alive. And then these stem cells, which are called satellite cells, they can be differentiated into new muscles. So the stem cells can be grown in vitro in the lab. And then when given the correct stimuli, they will develop into a real human muscle. So, however, we also need to mature these muscles and ensure that they are really functional. Because what we see is that the muscles that we develop in the lab, if we just grow the cells and differentiate them using the another type of medium which contains the correct stimuli to make them differentiate, what we get is a sort of fetal muscle tissue. which looks like this. So the myotubes are, so these are the myoblasts. These are the cells which will become the myofibers, so the fibers within the muscle tissue, and they align and merge. So they become, multiple cells become one fiber. And this way, several of these fibers can be made, but they still need to mature into a real muscle fiber, which is shown here, in which the nuclei, though the nuclei are depicted here as black circles, the nuclei, they all go to the outside of the muscle fiber, and also there is a striping structure in the fibers, which tells us that they are functional, so they can contract. And this shift is quite difficult to make in the lab. So what can we do to obtain mature skeletal muscle? So what we want to do is we want to develop new muscle tissue. For example, if somebody has an accident or a tumor and muscle tissue has gone or needs to be cut away, this muscle tissue needs to be replaced. And nowadays, this is done by taking muscle tissue from another part in the body. But for example, if you have somebody who is having cancer, it can be that this person is already very weak, and adding another wound in another part of the body can be very deleterious. So what we want to do is take some cells, so a very small biopsy of the patient, and then grow the cells in the lab, make new muscle tissue, and then give that new muscle tissue to the patient where it's needed. So, but in order to do that, we need to have mature skeletal muscle, and there are quite some tools that we have to help us to mature the muscle from the embryonic type tissue to the really mature fibers. And today we are discussing two of those, because using the piezo-ionic hydrogels as a scaffold for the cells to grow in, we can combine two advantages. So first of all, the cells, so muscle fibers, they tend to grow and mature better if they are stretched from time to time. So it's the same if you are going to the fitness a lot and you are stretching your muscles a lot, then your muscles will grow. And then you also have electrical stimulation, which means that if your muscles are electrically stimulated, they will contract. So these are the signals that are given normally by the central nervous system or the peripheric nervous system. So, and using the piezo-ionic hydrogels, we could combine both, because if we are then pushing or stretching the hydrogel in which the cells are growing, then we could evoke electrical stimulus as well. So there are already some conductive materials, so not piezo-ionic, but conductive materials that are being used in order to have an electric current through the tissue engineered muscle in order to help it mature. But they all have some advantages and disadvantages. So for example, it can be that they are less biocompatible, or that they cannot be degraded in the human body, or the electroconductivity is less or better, or the solubility in water isn't good enough. And of course, this is important because our body is a watery environment. So, and that's what we want to do, is to develop a hydrogel which has piezo-ionic properties, and which has as many positive so which is as biocompatible, as biodegradable, as conductive, and as soluble in water as possible. So now what we want to do is to develop new piezo-ionic hydrogels, which have all the nice properties that I just mentioned, but they are also piezo-ionic. So this means that when pressure is applied, that an electric current will occur, also helping the muscle tissue to further mature. So what we do, we have the polymers and we put them either in a hydrogel or in a film layer, so a layer, or we spin them into fibers, or we make a more robust or a more firm scaffold. But for muscle tissue applications, mostly a hydrogel is used. So then we add the myoblast to the hydrogel, and then we can start to stimulate these preliminary muscle tissues in order to develop real muscle fibers and mature muscle fibers. And so we can do this via electrostimulation and or via mechanical stimulation. But the advantage of the piezo-ionic hydrogels is that if we apply mechanical stimulation, then at the same time there will also be an electrostimulation. So we start based on a gelatin polymer. Gelatin is a polymer which is found in the human body, so it's a natural polymer that is perfectly biocompatible and biodegradable. But in order to make it more a variable hydrogel, so that more compounds can be added to the hydrogel, we put it together with metacrylic anhydride in order to produce the GELMA polymer. And this way we have more functional groups which are available in order to add other components, such as a cation or an anion, in order to make these piezo-ionic hydrogels. So we can then develop a cationic hydrogel or an anionic hydrogel, as has also been explained in the presentation of Nicolas. So then what did we do? First of all, we tested the physical chemical properties of these type of gels. So first of all, we took pure GELMA as a control condition, because this is a hydrogel that is being used a lot in tissue engineering applications, and it has been shown that it has excellent properties to be used as a hydrogel. And then we also used the GELMA containing 30% of the SPA ion or 30% of the eta ion. And then we compared, for example, here the storage modulus, and then we saw that in the three conditions, there is a similar formation of the hydrogel, although the gels containing the ions have a little faster cross-linking after UV exposure. And then we also looked at the gel fraction when incubating at 37 degrees. Why do we do this? To see whether there would be, for example, a degradation happening inside the polymer, so that maybe toxic components are leaching out of the hydrogel. But luckily, there was not a big change in the gel fraction at 37 degrees Celsius. There is here a small difference in the SPA gel, but as you can see, it's still a small difference compared to the control GELMA condition. So this allows us to believe that there will not be a large toxicity of these hydrogels due to the leakage of monomers or other components. Then we have also shown that these gels can be depolymerized by enzymatic degradation, and this there is no difference between the three types of hydrogels that were tested. And there is a little increased swelling in the gels with the ions compared to the standard condition. Then if you look at the tensile properties of the gels, So there is a similar tensile strength. So this means that what is the strain is then applied on the gel, and then it's looked what the stress, what kind of stress is measured on the gel. And this is the same in the three gel types. So this means that you can stretch them similarly. And then if we look at the total elongation, so this means that if you use the same force on the gel, how much does it elongate? And then we do see that the elongation is larger in the standard condition, so in the JALMA condition, versus the conditions with the SPA ions. And then the Young's modulus doesn't change over the three conditions. There was no statistical significance. And then, of course, the most important part for us was to see whether the myoblast can survive on the hydrogel. And so we tested C2, C12, which are most myoblasts. It is so this we can use to make mouse muscle tissue. And then first of all, we saw that the myoblasts survive equally well on the three types of hydrogels. So this is the standard JALMA hydrogel, and then with the two ions included in the hydrogel. And then there is no difference. So what you see here, the cells are seated on the hydrogel. And this is day one, so 1 day after seeding. And then the cells are followed up and stained. The dead cells are stained red, and the living cells are stained green. And what you can see is that on increasing days, so if you look later, then more and more cells, of course, are there because the cells grow and divide. And then what you can also see is that there are some red cells indeed, but on overall, we see that the cells grow well on all hydrogel types, and that's mostly they are looking healthy. There are always some dead cells in a cell population, but in all conditions, we could see that the cells grew well. So there was no big toxic effect. So this was quantified as well. And here you can see the cell viability on the different days. And you can see that there is no difference in the viability of the cells in the three conditions. And then we also looked at the metabolic activity. So that this means that the number of metabolites that they produce are measured in order to see whether the cells are metabolically active, which means that they are growing and dividing, and that in fact they are healthy. So, and also here we could see that indeed there was more and more metabolic activity because there were more and more cells, and there was also no difference between the different hydrogels. And then we also looked at if we could differentiate these myoblasts into myotubes, so this is the process that I described in the beginning, so that the myoblasts, they merge together and then they make long fibers. In the correct conditions, you can easily let the mouse myoblasts evolve into myotubes, but of course the gel can affect this process, and this is what we wanted to see in this experiment. And what we saw is that this is day 4 after the differentiation was started, so after the myoblasts were started to be pushed towards the myotubes. And then again we saw that in all three conditions we could make myofibers. So the myofibers are depicted in green. So the green is a myogenic marker. So only myofibers are stained green. And then the blue are the cell nuclei. And then you can see that there are also cells which are not within a fiber. So then these are cells which have not been differentiated. But as you can see, there is no big difference in the amount of fibers that are being developed. And this is also quantified here. So this is the width of the myofibers. So the wider the myofiber is, the more the more cells have been fused in that fiber. And then this is the fusion index, which indicates the percentage of cells that undergoes fusion to form myofibers. So if this would be lower, then it's worse because less cells can be differentiated into a myofiber. But again, there is no statistical difference between the different hydrogels. So the normal hydrogel, Jalma hydrogel, or the piezo-ionic hydrogels. So in conclusion, we can state that these new piezo-ionic hydrogels have similar physical-chemical properties versus the standard Jalma, and also similar cytocompatibility, and that there are unchanged differentiation properties of these myoblasts versus standard Jalma. And they have the extra advantages that they're, now that these are added to the gel, that there are multiple options to modify the properties of the gel. So if there would be problems, or so the gel can always be further improved. For example, the percentage of the ions can be changed, or the stiffness of the materials can be changed. So there are still multiple options that we have when we are looking at the material properties, so we can change it when making the gel or after the gel was made. So this means that it could be used for different applications as well. Okay, so then I end with some future perspectives. So in our 2D setup, so this is what I have mainly shown, is that the cells are grown on top of the hydrogel. So what we now want to do is to stimulate the hydrogels, so mechanically, and also induce then an electric charge in the hydrogel. And then we can do conductivity measurements on these hydrogels to see whether we can effectively have a charge in the hydrogel when the cells are seated on top. And then evaluate the cell growth and differentiation when these hydrogels are being stimulated. So to see whether the differentiation improves or whether maybe we have more cell growth. And then we also aim to do a 3D setup. So this is then to really make a 3D muscle structure. But before we can do that, we have to develop the piezo-ionic hydrogels that allow cell encapsulation, because now the cells cannot survive yet within the hydrogel. And then we want to construct the 3D bioartificial muscles and see whether the maturation of the bioartificial muscles can be improved using this mechanical or electrical stimulation. Okay, so I would really like to thank all the partners in this part of the project, so which were Chloe and Margarita performing the experiments in the lab of Professor Torre. And Chloe also, it was a joint PhD with University of Ghent, and she had a student, Robrecht, and they were guided by Professor Van Vlierbergen. And then the properties of the materials were also tested by Nicolas in the lab of Professor Rakes. Then, of course, I also want to thank Interreg for financial support.
Thank you
very much.
Melanie. Thank you. Thank you. So these first talks gave us how iontronic and how and Melanie, you you also speak about biological effect. And of course, the main question is how can we be sure that the human body can accept these new objects? And maybe Marie Dubus from URCA can help us to understand it for another 3D4Med investigation. Thank you, Marie, for sharing your presentation. It's okay, everything is nice. Thank you very much.
Perfect. So good afternoon, everyone. So I'm Marie Dubus. I'm a postdoc student from a BIOS laboratory of the University of France in France. I'd like to present to you a part of the 3D4Med Interreg project, which was presented previously by Samira. And this part of this project is a collaboration between the different partners and especially with the IMT. And this project consists in the development of scaffolds for bone regeneration. And in this context, we are trying to develop 3D printed scaffolds for bone tissue engineering applications. So tissue engineering is an important field of regenerative medicine that aims at combining regenerative cells with the scaffolds on which they can develop with the help or not of growth factors in order to repair or regenerate the different organs of the organism. And for this project, we will focus on the development of these scaffolds, but for bone regeneration. So the best scaffold for tissue regeneration is the scaffold that mimics the best the tissue to regenerate. So you need to know that bone is a hybrid material which is composed of an organic part of collagen fibers and of an inorganic part of hydroxyapatite particles. And to be used in bone tissue engineering, the scaffold is implanted as a damaged site to replace the missing bone as long as necessary for the bone to regenerate. The scaffold, in fact, has to degrade at the same time the bone is regenerating. That is why the scaffolds need to lure the original bone by mimicking it the best possible way. And therefore, in order to develop the best bone scaffold, we have to respect strict the scaffolds need to be tolerated by the organism, so it has to be biocompatible. It also has to be bioactive to stimulate bone repair, and it has to be biodegradable, as I mentioned previously. And to mimic bone, of course, the best solution is to develop a hybrid material. Regarding its geometry, the scaffold needs, of course, to fit where it will be implanted, so the shape has to be adaptable. And another crucial parameter for scaffolds is their porosity. Indeed, the scaffold has to allow the different cells to invade the scaffolds, and it has to be pleasant for the cell. That is why the pore size is determined according to the cells we want to host inside the scaffold. And moreover, once inside the scaffold, the cells need to be fed in order to live. That is why the pores have to be interconnected to allow the diffusion of fluids and nutrients to the cells. Then we have the topography, which is an important parameter for bone regeneration, especially as the roughness of a scaffold can induce or stimulate stem cell differentiation. And then the mechanical properties are also a crucial parameter because it can also induce stem cells fades. And we are trying to develop scaffolds with the similar mechanical properties as the bone. And we think that 3D printing can help us to reach all these strict features to design scaffolds for bone regeneration. Indeed, among the main advantages presented here, the control of all the previous required features is possible with 3D printing. So we decided to use this technique to print 3D scaffolds for bone regeneration, and we chose PLA and hydroxyapatite particles to mimic the organic and inorganic part of the bone. And also we know that the PLA and hydroxyapatites are non-cytotoxic materials which are already used in tissue engineering. And we then obtained these porous cylinders with interconnected pores. And the parameters were adjusted by IMT to obtain the required features for bone regeneration. The next step was then to check the cell behavior within the scaffolds. That is why we seeded some stem cells on the scaffolds, and we cultured them for 21 days. And at day 7 and day 21, we performed a viability test. So you can see here the bars are representing the viability of the cells at the 2 times. And these first results show that we had a good cell viability, but this viability was not really improved after the 21 days of culture, which suggests, in fact, a low number of cells after the 21 days of culture, and therefore a low proliferation of the cells. We then decided to think about how to improve these scaffolds to obtain a good proliferation of the cells. And our hypothesis was to remove, in fact, the contours of the scaffolds, which could prevent the fluid exchanges and then the diffusion of the nutrient to the cells. We therefore developed the same scaffolds, but with the contours removed from the scaffolds. And we performed the same viability test at day 7 and day 21. And this time, as you can see on the graph, we observed a cell viability which was far more important for the cells cultivated with no contours than for the cells cultivated with contours, which confirms, in fact, our hypothesis to remove the contours for better fluid exchanges. This results suggest that we have more and more cells in the scaffold over time, and then we check this suggestion with labeling, in fact, the cells after the 21 days of culture. So you can see on this picture, we have the nuclei of the cells in blue and the cytoskeleton in green. And you can see that we have a lot of cells that are aligned and elongated on the fibers of the scaffold. But also we have, in fact, here you have the pore which is represented, and we have also cells inside the pores of the scaffold. So the conclusion of this scaffold is that these scaffolds are biocompatible for the cells, and that the 3D printed technique allowed us to obtain scaffold with most of the required features we would like for bone regeneration. Especially the scaffolds we obtained allowed us to support living cells inside, thanks to their biocompatibility, but also their porosity. So 3D printing is therefore a suitable technique to elaborate scaffolds for bone regeneration, especially as it allows to control the design of the scaffolds according to the application we want. And for instance, another project we have in collaboration with the 3D4Med partners is to find some solution to the Sinus Lift issue. So the Sinus Lift is also called sinus augmentation. This is a procedure that makes it easier to place dental implants. Indeed, some patients need dental implants but have suffered bone loss, as you can see here. And so they don't have enough bone to support the implants. And the solution the dentist found that they put some bone substitutes here between bone and between the sinus in order to improve bone regeneration. But these techniques has some drawbacks. For instance, the sinus is very delicate, and some bone substitute particles can perforate this sinus. So the idea is therefore to develop a scaffold for bone regeneration that does not possess particles and that does not perforate the sinus. However, the issue we have is that the access to the bone defect, as you can see here, is very small, and the defect to regenerate is bigger than the access. So our idea was then to use a shape memory material. So we used the TPU for thermopolyurethane. This is a polymer which can be deformed with a force, as you can see here, and with a stimulus, for example, the heat for the TPU, it can find back its original form. So in IMT, they managed to print TPU scaffolds, which were able to be compressed, and then with hot water, they go back to their first shape. So our idea is to compress the scaffold, to put it in the bone defect, and then the scaffold should be able to redeploy itself and to occupy all the bone defects. And then the first step here was also, of course, to check the cytotoxicity of the scaffolds. And for that, we seeded some cells in a plastic culture plate, and we put the scaffold in contact. And we checked the cell viability, and we observed that the presence of the TPU scaffold had no impact on cell viability, so the scaffold was not cytotoxic. The next step was then to check if the cells adhere and proliferate inside the scaffold. So for this experiment, we seeded the stem cells directly on the scaffolds, and we checked their viability at day 7, day 14, and day 21. And what we observed is that we had an increase of cell viability over time. And this cell proliferation and adhesion was confirmed by the cell labeling on the scaffold. As we can see here, you have a lot of cells aligned on the fibers of the scaffold. So we can say, to conclude, that 3D printing is an attractive technique with a lot of advantages, which allows to develop scaffolds with controlled features for many applications. And to conclude this presentation, I think it's important to notice that collaborations between all the partners and between the different labs with their own expertise are crucial in order to achieve projects such as this one, from the development of scaffolds, the characterization, and to the biological studies and the potential applications. And I would like to acknowledge all the partners of the project and you for your attention.
Thank you very much. Really, thank you, Nicolas, Mélanie, and Marie for this excellent overview of 3D4Med progress. So I don't know if someone has has questions or remarks after these 3 application of smart materials for biomedical fields. Please feel free to speak. So if not, maybe we can listen the last speaker, Valenti Prat from Barcelona. Thank you, Valenti, to be here with us to discuss about another Interreg project and another program. So please feel free to share your presentation.
Thanks a lot, and yeah, hopefully I can keep it brief. Just to mention also that my colleague Charlene, also from Bugs & Company, is also in the call. So yeah, well, it's both of us in here, and yeah, between us two, we'll share with you a little bit what's MatMed about, and where we are, and what are the next steps, and also why we are here, right, in the first place. So maybe I can start with that. I mean, it's very interesting to see what the 3D4Med project is about. I think that you're more focused on, let's say, pure research than we are. Well, we do have researchers, of course, but we are more, let's say, the middleman between research and industry. So I think that's already some difference that we see, but it's still interesting to get in touch with you, and because, yeah, after MatMed, of course, we will still try to do interesting things with Interreg. So yeah, it's good to be in contact with you. So starting with the first slide. So what's MatMed about? We have been, as Bugs & Company, involved in several Interreg projects focused not only, but also on health. These projects tended to be more generalistic. So we used to create voucher schemes, meaning that we gave some financial aid to SMEs to develop their innovations. We are quite familiar with this process, but we also wanted to focus on something more specific. So MatMed in this case is supporting SME innovations in between two different fields, so between advanced materials and regenerative medicine. We also opened this up a little bit, so some medical devices that are not purely regenerative medicine we also work with, but that would be the main concept. So in order to do this, we since the beginning of this project back in 2018, we set up 3 different main activities. One, I would say probably the most important one, is what we call an acceleration program. So what we have in this project to begin with is a matchmaking platform. So you can, I'll put this in the chat, by the way. We have this online portal called www.matmed.eu. You'll see that now in the chat, where it's basically, we like to call it like a little bit in a funny way, like a Tinder for matchmaking of health-related SMEs. So in here you will find almost 300 players from different areas in the Northwest Europe area. So the first thing I want to say is that MatMed covers a broader area than the France, Wallonie, Vlaanderen Interreg program. So we do have an overlap. For example, we have the University of Ghent. We have, well, we don't have a French partner, but we also have some French SMEs in our project as well. But we also have UK-based organizations. We cover the Netherlands, Germany. So it's a broader program area. In any case, what we do here is that we foster for matchmaking between SMEs. So imagine that you have an SME A that's developing a new technology, and they need, for example, some lab support. They can match with this lab, and we basically compensate. We provide this financial support to them for a voucher of up to 25,000 euros. So it's a relatively large sum in size. And in exchange for that, we ask for a TRL increase. I'm not sure if everyone's familiar with the TRL concept. So between 0 and 9, basically, 0 would be to have a new idea, a new innovation, and 9 would be to when this innovation reaches the market. So of course, there are many steps in between that. And what we want to obtain with this financial aid basically is written confirmation that this innovation has gone, for example, between TRL 5 and TRL 6, let's say. That could be, in this case, some technology demonstration. Well, it depends on the case. We will share with you a couple of examples. But we have been doing this since 2018, as I was saying. We have granted 30 of these vouchers. We think that it's quite successful because it's not easy to find these. Well, first of all, to create these matches and then to give them this financial support. So we're quite happy with this number. The second activity that we do in MatMed is to attract private investment. This is a much more common and simple activity. It's basically connecting our pool of SMEs with investors throughout Europe. And basically, yeah, we put them in contact and we basically work with them to try to obtain some financial investment to these innovations. Last but not least, we also have something that's quite new, I would say. So most of you will be familiar with these new medical device regulations being implemented at EU level. This is affecting, of course, many SMEs in the EU. And what we found was that most of these SMEs were not, well, some of them knew, some of them were less familiar with what this meant for them, what changes they needed to implement. So what we do as well is to perform some regulatory workshops. So we explain to them what they have to do in order to be adapted to these new regulations. Again, we have been doing this for quite a long time now. Sweet sour news, I would say, is that our project is coming to an end relatively soon. So we will we'll close the project at the end of this year. If there's any question, of course, feel free to interrupt me, or you can also save your questions for the end. Actually, I think I have explained most of what's in the slides already. Well, here you have maybe a little bit more of an explanation of what this acceleration program is about. So technically, we have 3 stages for this program. So the first stage basically means that when we have this match that I was saying before between SME A and B, we review this case and we see if it fits our project scope. As I was saying, it's relatively reduced. So it has happened that some of these matches have been discarded. Once there's this green light, basically these SMEs send us an application form. And if they are okay with it, and all the partners are okay with it, we approve this voucher request. And I was saying before these TRL levels, this is important because I also mentioned that the maximum size of 25,000, but this only applies to what we call the stage 3. So if you have an innovation that's in a lower TRL level, like it's still in not in a concept phase, but in an experimental phase, you have a different threshold. You can ask for up to this 12,500 euros. If it's in a more advanced, then you can obtain this 25,000 grant. I have to say that since we are reaching the end of the project, we are almost out of funding for these vouchers, but we might still have maybe a couple of cases that we could eventually fund. So if you know about SMEs in your network that would be interested in this, they still have time to register in this matmed.eu. And even if there is no more funding left, I think it can also always be interesting to join this platform and check who's out there. Basically, there might be some SMEs in your area that maybe you're not aware of, or maybe you are. In any case, I think it's good. You lose nothing basically for registering there and checking who's there basically and who can be interesting for you. Okay, the rest I think I've already mentioned it. Yeah, I've quickly touched upon the results, but yeah, maybe I can mention that. Well, actually, the number of vouchers that I was saying is now up to 30, so we are a little bit over this number. An interesting fact, and it's something we didn't count at the beginning, is that most of these SMEs came to us saying that 5 years from now, 5 years after we provide this funding, in most of these innovations will be on the market, or at least they expect so. So we also are asking them how many jobs will be created 5 years from now. And we see at the moment that we can secure probably some 100 jobs, at least what we can return to Interreg, what we expect to create through this, some people call it cascade funding. What else? Regarding the private investment, we have a prospect of, towards the end of the project, to confirm some 4 to 4.5 million euros as private investment. Something I didn't say is that this is at least twice as much as what the Interreg has put as public funding to our project. So only with this activity we would be already sort of multiplying this capacity, or multiplying this money. What else? Well, my colleague Charlene is also with me, as I was saying. Charlene, I'm not sure if we have me in the call. We wanted to invite one of our project partners. No, I don't see her.
Yes, good afternoon, everyone. I'm Charlene as well, working with the Valenti MatMed project. And yeah, we're still waiting for our colleague Me, but I don't think she had joined yet.
Okay, well, maybe I can just take another minute and talk about the real case that we've had. We are not the experts, let's say, in the regenerative medicine or the medical device field. So please excuse us if what we say is not exactly accurate. But for example, one of the cases we have had, one of these 30 cases, is a British SME called Elucida. So they wanted, they are still developing so-called fast PCR technology. And basically, to do that, they needed access to corona samples. This was proven to be not easy to do. They didn't have access to it where they were sitting I think it's in Manchester. So we found a service provider in Germany called Carpigen, and this was the match that was formed in the portal. Thanks to that, they obtained this financing to test these corona samples, and with that, they improved their TRL level. Well, we can check. I recently checked their website, and they seem to be in a relatively advanced level already. So hopefully, this PCR technology will be on the market soon. They use, again, I mean, we haven't participated directly, but they use some sensors for that. So the idea is that it's a much faster process than the traditional PCR technology. And well, everything is coming to an end, or at least that's what we have on paper. We were saying that, well, as I was saying this before, that MatMed is officially coming to an end this year. However, project partners are quite satisfied with the project, so they are working on an agreement to sustain some of the activities. And I think it's also something that all Interreg projects should at least try to do. So what happens after we no longer receive funding from the authorities? In this case, we will try to keep this online platform that I was referring before active. So that's why we are still encouraging you to register there. Hopefully, this will lead to more international matches, even if there's no public funding anymore. And we have also seen basically the success of these regulatory workshops that we were saying. So we have doubled the target that we had in this activity. So we want to keep some of these regulatory workshops active as well. And I think maybe it's something that even for you, I don't know if it could be interesting for you to do as well to your SMEs or not. That's one of the questions that we have. Have you done these type of workshops outside of Interreg? Would you be interested in doing that? Our feedback is quite positive from the SMEs, and it's something we want to sustain as well after the end of MatMed. Having said this, I think that's all we had for you to share to you today. Charlene, I'm sorry, I think we agreed that you would do the last slide, but...
No problem, you presented very well.
So yeah, we are of course available for you if you have questions, if something was not super clear.
Thank you, Valenti. Clearly, MatMed is an additional Interreg project to advanced materials for medical application. It's exactly that I think 3D4Med needs now to propose our materials to SME innovations. I have no question now, but it's interesting to know that this platform exists, really. Maybe Mélanie, Nicolas, or Marie would like to add something. I don't know. I don't know, because you speak about SME partners, but it was it is European SME mainly, or global SME?
We have to stick to our program area as well. So these matches have to be first of all, they have to be international. So that's a limiting factor for us, of course, because the easiest would be to work nationally, like for example French to French SME. That's it's sort of a problem that we created ourselves. We wanted it to be super transnational, but only among the active countries of the Northwest Europe area. So that's, let's say, to keep it easy, from France to the north, let's say. But yeah, only these countries. So we are not working with any other country. So it's 6 countries, I think, in total.
Yeah, it's already enough to start with that, but it's very interesting to know that this platform exists, really. Maybe Mélanie, Nicolas, or Marie. To be interesting to meet some SME for your application.
Maybe I have just a question to be sure that everything is well understood, because you say that you will keep your different object, like the website for the requirement. Maybe after the project is finished, it will be more open to more countries. I don't know if you think about opening the the frontier or not.
Yeah, it's a good point, actually. Yes, I mean, the moment that we are no longer, let's say, an European project anymore officially, we don't have any limitations. So the more useful it can be for everybody, the better. So yeah, then we will no longer have this limiting factor, let's say.
Yeah.
One thing I think I forgot to mention is that we have been put in contact through University of Ghent, which I think it's I saw it's also a partner here. So Sandra is also actually working in MatMed as well. So that's, well, basically where the connection comes from. You can always ask UGAN directly what they are doing in MatMed. You'll see they all have plenty of cases to share with you, how they're helping out SMEs. For example, I remember they got leased this how is it called, this 3D printing machine, which I think connects with the work I've seen so far in these presentations. And they are helping SMEs in developing their 3D products as well through MatMed in this case. So yeah, it's less focused on, let's say, pure traditional research, more focused on we could call it applicable research, I guess. So directly to the SME. But yeah, that's what we are doing.
Yeah. So thank you. So I think we can just stop this talk.